I'm JP Ducra. I'm one of the Ashtabula County Commissioners. I'm very proud and privileged to be here today as a part of the Steering Committee for Remote Area Medical, or RAM. And on my left here I have Tina Krzyzewski, who's the Director of Business Development with Ashtabula County Medical Center, and Denise DiDonato from University Hospital. So, as well as numerous other members on our leadership team, we appreciate you giving us the opportunity today to talk a little bit about this RAM event that's coming to Ashtabula County, which is going to be a free medical, dental, and vision clinic primarily geared towards serving the uninsured or underinsured residents of our area and beyond the perimeter of Ashtabula County. So we are very, very excited about the opportunity. This has never been done in the state of Ohio, so it's kind of a cutting-edge thing for us. So we were real excited when Heather Johnson brought the idea to us, and we've been working feverishly since the summertime to try to put this together. So the clinic itself is going to be held on April 20th, 21st, and 22nd. That's a Friday, Saturday, and Sunday. And we will be doing setup on the 19th. And it's going to take place at the Ashtabula Towne Square. So Kenny Keister with the mall has been very, very gracious to donate the space at the old Dillard store, which is where the Bethlehem Experience was held over the Christmas holiday. So many of you may have attended at that. And so it's a great location to hold this at. And we're real excited. And hopefully we're going to find 400 to 500 volunteers coming together to help pull this off. And we hope to serve over 1,000 residents that otherwise may not have access to medical and dental and vision care that's going to be available at this facility.
I'm Tina Krzyzewski. I'm the Vice President of Business Development for Ashtabula County Medical Center. And we've been working with JP and the rest of the leadership team and Denise to bring this remote area medical clinic for over a year now. It is a massive undertaking, but it is something that this community desperately needs. And I personally would like to give some credit to John Patterson, our representative. I've been working very closely with his office to pass legislation that will allow out-of-state licensed medical professionals come and volunteer for our clinic. John has been great to work with on this, and we're going to have legislation passed. There is another RAM clinic that will be happening in Ohio in August, and so we're kind of setting the stage for success at that clinic as well. I also want to thank the Civic Development Corporation because they served as our fiscal agent. They have been the ones taking in all of the monetary donations so that we can put this clinic on. We definitely could not do this without the tremendous support of businesses, individuals, the various groups that have donated rooms for the volunteers who are coming in from out of town, that are feeding 400 volunteers every day for 3 days. It's been a tremendous amount of support from the community.
My name's Denise DiDonato, and I'm Manager of Business Development and Community Outreach for University Hospitals here in Ashtabula County. And as part of the community host group for RAM, one of the things that I really want to impress upon everyone is that we will not turn anybody away from this clinic. This clinic is here to serve the underinsured, the uninsured, anybody who is unable to seek medical, dental, vision care. And we know that there are a lot of folks out in our community who are not able to access these resources. And this really gives them a chance to come in and get the care they need to alleviate pain and suffering. All ages are welcome. We will treat kids, we will treat adults up through any age. And women's health is really something that we are looking at making sure we have a focus on, so we can provide some screenings for women that they may not be able to access otherwise, to help maybe find different issues they may have and treat them before they become a problem down the road. The other piece to this is being able to provide resources and information to those in the community that might not know what resources they do have to get medical care once the RAM clinic is gone, what type of follow-up resources are available to them, because we really do have a lot of great agencies in the community that can connect you with the resources that you need to get the health care you need. So not only is it providing health care on that day, but it's also providing information where you can go if you need follow-up health care at no cost or very low cost.
I think, one of the things that this clinic is going to show is the tremendous amount of collaboration that we see in Ashtabula County, especially when it comes to the healthcare programs and services above and beyond that. We will have some, vendor space available at the RAM event. so that organizations that may have anything that would, information that the community could benefit by, through social services, job and family services, extended medical service, transportation, other things that may be barriers to getting health care. We're going to try to have as many resources there as possible to allow the folks that attend to have access to that and know that it's available and have the information necessary to access it.
And we know from our community health needs assessment as well as our own individual hospital assessments what the specific needs are in the community, and access to health, barriers to access to health care has always been one of the things at the very top of the list. So this is just our opportunity to work collaboratively with other agencies that we work with really on a regular basis, but even more closer knit, and even I've learned a lot from other agencies of what they do offer that I didn't realize was available before. So I think it's just been, it has been a wonderful experience, and we will be providing a wonderful experience to people in the community as well.
I thought it was interesting that, shortly after we started talking about this clinic and the needs assessment came out within the school district at Ashtabula City Schools, and they really targeted as vision and dental as two of the most requested or greatest needs that they identified. So we do hope that this is going to be a solution for a lot of people to get access to that care that they really felt was a limiting factor in their ability to be successful in school and have access to while they were in the school district.
If anyone watched Mutual of Omaha's Wild Kingdom, you may recognize Stan Brock. He is actually the founder of Remote Area Medical, and it really started when he found himself helping in a third world country and had a serious medical issue and was told that it was days of a walk for him to get medical care. And for many years, he went on and provided clinics and airdrops of supplies to third world countries.
Kind of like early mission work, really,
yes.
What you would know today.
Correct. And then he realized that there are thousands upon thousands upon thousands of people in our country that need the same type of access to medical care because they don't have it. So RAM really started a focus on the United States. And since the organization's founding, over 740,000 people have gone through RAM clinics, and the value of that care is over $120 million. So we're making a huge impact in the lives of these individuals and really helping communities.
Yeah, it's, to talk a little bit about the clinic, and I didn't know what to expect, and my wife and I, who was on the steering committee with me, as well as Lori Herpin, Decato, one of our local podiatrists, we had the opportunity to go down and volunteer at a clinic in Charleston, West Virginia, and it was really a moving experience. We wanted to go down and kind of see the workings of a clinic and try to help us be a little more prepared coming back here to Ashtabula to put this clinic on. And the number of people that were there that were just so appreciative of us, of the volunteers that were putting this on, of the clinic being there, talking about how it was the only source of health care that they may receive in any given year, many with tears in their eyes. And it was really very touching. It was a very rewarding experience to help with that. And at that particular clinic, and they'd been doing that clinic for a number of years, I think the weekend, which was just a 2-day clinic, they served over 500 people and about $600,000 worth of free medical, dental, and vision care. So, with this being the first one in the state of Ohio, and certainly we know the dramatic need here in our area, we expect it to be significantly bigger, and we've even added an extra day to the clinic because of that.
It's amazing to think about individuals who will be able to come and receive their eyeglasses that day. And that there will be volunteers who are taught how to make those eyeglasses. These are individuals who probably have had vision issues for several years, maybe have some medical coverage but don't have vision coverage. It's an opportunity for them to come, get the glasses they need. They can see our beautiful county through 20/20 eyes.
And for the students, so many are getting diagnosed with learning disabilities early, and I think a lot of that can fall back to not having access to proper corrective lenses so that they can see and learn and be a part of the educational process. And so, hopefully this is an opportunity for them to help make their educational career that much more rewarding and successful.
I recall seeing one of the videos on the RAM website that was a testimonial from someone who had received glasses, and he had been a truck driver as part of his career and was unable to really do his job because he didn't have the right glasses. So just think, that may open up employment opportunities for people as well. So I think it'll have a trickle-down effect in the community that we just aren't yet anticipating, but I know we hope to bring it back again.
The hope is we can make it an annual event and certainly continue to bring it to Ashtabula somewhat regularly. You mentioned the website in the video that you saw, Denise. I mean, I think that's a great way to get a little more background and information about RAM. They have a tremendous website. It's ramusa.org. That's ramusa.org. And you can go to that website to see testimonials. You can see clinics that have happened. You can hear about the history of the organization. That's also where you can go to volunteer if you want to be a part of the clinic. So, in fact, really the only way that you can volunteer is if you go online to that ramusa.org website and click on the volunteer link, and then you can put in your information. They have a series of questions, and then you'll get updates leading up to the clinic, and certainly on clinics in the future if you wish to go to another location and volunteer. You know, RAM's leadership team has really asked us to encourage signing up early, making a commitment. You do not need to have any healthcare background to be a volunteer. That's another, I think, thing that's made some people uneasy. A lot of the folks that I've talked to said, well, I don't know anything about nursing, and we're going to need lots of volunteers that are just sort of general support, doing registration, helping with crowd control, helping to ease some of the anxiety that maybe some of the people that are here that day are going to have, giving direction, set up and tear down, just simply getting the trash in and out of the building from an event that's going to have 1,000+ people at it is going to be an undertaking. So there's ways that anybody can volunteer, and if you go to the website and get that done, the more people that we have committed as volunteers ahead of time, the easier it will be for the professionals from RAM to plan and dispatch the appropriate amount of leadership from their organization to help us make sure we have a successful clinic.
So, you know, our volunteers are coming from all over the county. So we do have medical volunteers, we have nurses, we have medical assistants, we have physician's assistants, nurse practitioners, physicians, podiatrists, you name it. I think we're getting it on the list. Dentists, Healthy Smile Center actually has really taken a hold of this and really has helped with recruiting efforts along with Case Western Reserve Dental Schools. There are professionals coming actually not just from this county. We've got people coming from all over the state to help with this program. So it is not a one entity, it is a combined effort of resources. We will take volunteers from anywhere in the state that we can get them, medical or medical professionals of any kind. So it's not about any one specific entity. It's about all of us together.
And the more volunteers that we have, the more people we'll be able to serve. We won't turn anybody away that shows up. You have a very, very minimal registration process, so they're not, checking or they're not questioning your income level or the benefits that you currently receive. Anybody that shows up is certainly welcome to receive service, but we may run out of available manpower to serve everybody that comes. And that's one of the reasons, at least, that I was amazed at the people that when we worked the clinic in Charleston, that were there from 10 o'clock, midnight the night before, sleeping out, on the sidewalk or in their cars like they were waiting for concert tickets almost. I mean, they were so concerned about not being able to get a ticket to have a position in line to be seen. We want people to know, again, we encourage anybody to come, but if you think you're just going to walk in at 2 or 3 o'clock in the afternoon and automatically you're going to get, a pair of glasses or get an opportunity to see a dentist, that may not happen. So it is important to come early, to get in line, to get a number, and to do it in an orderly fashion so that everybody can, get their turn in line to be seen.
Bring a chair if you're coming for the services. If you have a stadium chair or a folding chair that you can bring with you, bring that. Bring a book. Bring your, if you have an MP3 player or something to listen to music. Right. Because what we can't do is have individuals come, get a ticket, and then leave. To be able to keep the clinic moving and to serve as many people as possible, we do need them to stay that entire time. Because of the time constraints with vision and dental, you have to choose between one of those two services. Everyone can go through and receive the medical care, but we do ask that you choose between either the dental or the vision on that particular day because they're a little bit more time intensive. And again, we want to serve as many people as we possibly can.
So we will have, you talked a little bit about how early people arrive so that they're in place to get their ticket. People will be in the parking lot at Dillard's. We are working up a plan to have traffic control. We will mark the cars as they come in that day and identify who gets when we start passing out the tickets, what that order is. So it is going to be very organized. There will be a lot of manpower just in that parking lot alone to help manage that. And we will certainly process absolutely everybody we can, but it is going to require a lot of patience as well. So we just ask that,
we need patience from the patients.
Right. As Tina said, bring stuff to keep yourselves a little entertained, a little occupied, a little, because it might be several hours or a few hours at the minimum. But everybody that we can process will get through, absolutely.
It's going to be on Friday, Saturday, Sunday, April 20th, 21st, and 22nd. And then on the 19th will be pretty much a full day of setup, getting everything prepared for the clinic and arranged, and furniture and medical equipment and everything in place. The only questions that are really that they're primarily concerned about at the registration are going to be some medical history. So wanting to make sure if you've got a history of a particular condition or illness, or might be on a certain medication, or something of that nature, so they can sort of direct you and be aware of that, so that again, we get you the care that you need, and we make sure that you're not at risk for anything in particular. So one of the questions that some people had is, people may show up here in almost an immediate medical need and not even realize it. So part of the screening process is going to be to identify somebody that may have excessively high blood pressure, or maybe their sugar is terribly high, or something of that nature. Ashtabula Township Fire Department is right across the street, so they'll have EMTs there if they're not actually stationed right in the parking lot, to be able to go on call from there. The EMTs are located right across the street, and they'll be able to. We've got University Hospitals is immediately next door to where the Dillard's is, if you need some help there. And of course we have ACMC right around the corner as well. So there'll be plenty of access if there's somebody that's in immediate need of medical attention, and they can be referred out and have somebody come in right away to help them. And if you find that there's something that is kind of borderline, their goal is going to be to try to get them some medication, or get them to relax or decompress a little bit, so that they can then get their vitals within a range that then the medical staff is comfortable treating them. Again, we don't want to turn anybody away. If they really need the help, we want to try to make sure that they're able to be seen.
And we will also have a list of providers that are willing to do low-cost or no-cost follow-up care. We know that this isn't a one and done for many of the patients that will come through the clinic. So we will have access to resources that we can kind of point them in the right direction for anything that needs help with beyond the clinic dates.
We really have been very vague about our sponsorship, and that's really because we've had continuing in-kind donations and things coming in, and we really don't want to leave anybody out or hurt anybody's feelings. We've had a tremendous amount of sponsorship and assistance from local organizations, not-for-profits. We've had lodgers, we've had restaurants and caterers, medical facilities, business professionals, individuals, foundations in the county, and they will all be listed on the T-shirts that the volunteers will have. So there will be a lengthy list of all those people that have really helped pull this together, and we appreciate their help also very, very much. Volunteers are really going to be what makes this happen. Right. As we mentioned, going onto that website, if you can please log in and volunteer at ramusa.org, and click on the Ashtabula event, and you can volunteer from there. We're taking volunteers not only Ashtabula County, but outside of the area. Anybody who sees this, we drove 6 hours to volunteer for the clinic down in Charleston, and we're hopeful that we'll get some people coming up from the Massillon area where their clinic's going to be held, so they can kind of get a feel for what this is like, and any other areas would be greatly appreciated. We really need dentists and vision professionals. Dental care professionals and vision professionals are going to drive the success of this clinic. So I'll reach out to the audience and let you know, if you know of anybody who's in that field that might be willing to volunteer a day of their time, it would really make a big difference in providing these services to people that otherwise may never be able to receive it. next time you go and get a teeth cleaning, tell them that guilt them into coming to help out with this event. We'd really appreciate it. Giving you the website, you can go there, but we also have a phone number that you can call if you want to ask questions specifically. That number is 440-990-1919, and email would be ramashtabula@gmail.com. So one of our team members is receiving those phone calls and responding to those emails, and they can direct to the appropriate person if there's a specific question that they can't answer. So another thing that I'm that we know will be very helpful to the clinic is that if you know of an organization that may have a significant number of tables or chairs, we have rented, I think, every one that we can here in Ashtabula, and I think we're still going to be short. So if you know of if you're a church or maybe a party center or someplace that might be willing to donate tables and chairs, we want to make sure that they're clearly labeled so we could return them to you. We can arrange for pickup if you can't deliver them, and we would be really pleased if we could get some donors of tables and chairs. That's going to be a big expense for this clinic, and if any amount that we can actually get donated to us for the 4-day period, Thursday, Friday, Saturday, Sunday, will be that much that we can sink back into the clinic and providing services for the citizens that need it.